Now, President Obama will head to Chicago tomorrow to push his new health reform plan to the American Medical Association. Last week, the AMA spoke out against the president's hope to create the option of government-funded health insurance. So how would the public option insurance work? ABC's John Hendren joins us from Washington to explain. John?
Good morning, Bob. Both sides in the debate agree that a public-run health plan would run something like the mail, but they disagree over whether that's a good thing.
President Obama wants a government health plan to compete with private insurers.
I also strongly believe that one of the options in the exchange should be a public insurance option.
The Senate's top Democrat says a public plan would work like, well, the post office.
The Postal Service may not be perfect, but because that public option is there, the private companies, FedEx, UPS, DHL, know they can't get away with overcharging you, ripping you off, or slacking on their service. Just like our proposal for the healthcare system.
The idea works like this. The post office offers a cheap, reliable service. UPS, FedEx, and DHL might deliver broader service, say faster delivery and more options, but they cost more. In the same way, a government health insurance plan would offer cheap, basic care. The problem for critics is that the government has an advantage.
Congress sets the rates. They determine what a first-class stamp will cost.
Insurers say creating a public plan is a little like starting up a postal service where there was none. The cheaper newcomer attracts more and more business, eventually leaving little left for the private companies.
It becomes eventually the basic core of plan for regular delivery, and the private sector just does the bells and whistles.
Insurers' predictions are even more dire.
We're creating a new government-run program that is going to swallow up everything else.
Democrats say insurers just don't want the competition.
You don't have to choose the Postal Service, but it's good to know it's there, and for some, it's all they can afford.
Supporters of a public health plan admit that insurers would lose some of their current customers, but they note that the president's plan would add 45 million uninsured Americans to the health insurance rolls, a vast, untapped market of new customers.